mercury. Mercury has a high affinity for sulfhydryl groups. That's why alpha-lipoic acid is a helpful guy. And that's why glutathione is helpful. Because we want to get these enzyme systems working, SOD and catalase, to improve the antioxidant capacity. And it's nice because the studies that show that SOD, catalase, and glutathione peroxidase are all improved when people do hyperbaric oxygen on a serial basis. You'll actually get these enzyme systems to work better in the body. There have been papers written on this topic, which is another way that hyperbarics helps. So the chelating needs to grab onto and remove. As environmental exposures become more toxic more readily in ASD kids and other kids, this causes more problems with inflammation and inflammatory diseases and autoimmune diseases. And as I mentioned before, a lot of the people on this planet have an MTHFR problem. So methyltetrahydrofolate reductase enzyme, SNPs, the polymorphism that exists, leads to people having problems with altered detoxification methods. If they cannot get rid of this, because mom and dad gave them an MTHFR, and this little kid has it, then we have a problem. And to test MTHFR in the States is a very expensive event. So most people don't test MTHFR. And if you do, then you will find out this kid can't methylate well. If you can't methylate well, you can't detoxify well. So you can't keep giving these moms folic acid to prevent neural tube defects and not think, well, if they have an MTHFR, they can't use folic acid in the right way. Maybe we should give them methylfolate or folinic acid. That will be a methylated form of folic acid to get the body to do what it's supposed to do. Because if 35 to 50% of the population have an MTHFR problem, which they do, then all the folic acid in the world is not going to do the job that methylfolate would do. So, and I usually consider autism a heavy metal retention disorder because we really see the responsiveness from doing detoxification methods on these kids. Either topically, orally, or the best way is IV to help bind the toxins for appropriate excretion. So to chelate, to grab onto and remove, just like this bird is finding what is it attracted to and pulling it out of the body. I've been using chelation therapy since 1994 in my practice, along with osteopathy and hyperbaric and other holistic approaches. I'm a DO who actually does spinal adjustments and then trained as allopathic medicine, and osteopathic medicine is so similar, but we can get to use a little more holistic approach, which is probably why I got involved with it and learning about these different topics. Many of my heart patients, cardiovascular patients, have been able to avoid or delay coronary artery bypass stents, or stents, with great reduction of blood pressure in diabetes problems, erectile dysfunction problems. If you improve circulation, you will end up having a better quality of life. And if you can reduce the oxidative stress by reducing and removing these free radical generators, then less inflammation will occur. I've had diabetics get off of insulin by chelating them. There was a great study that came out, a double-blind placebo-controlled study in November 2012 with 1,700 patients. Some did chelation therapy, some did not do chelation therapy. So they were randomized, double-blinded, just like doctors like. It showed, and they were all the same. They all had a heart attack in the past. They were on aspirin, a beta blocker, and a statin, traditional therapy we do in the States for everybody with a heart attack. And they showed a 38% reduction in acute myocardial infarction recurrence, stent, hospitalization, death, or stroke, 5 parameters. They showed a 38% reduction in people who've had acute MIs in the past from an anterior wall, a 37% reduction in diabetics for hospital admissions of those 5 parameters, and 18% reduction in everybody who had a heart attack in the past when you detoxify them and remove the metals out of the system. That's in the cardiovascular world. In the autism world, as I mentioned before, Dan, the Defeat Autism Now, had this study, this ARI study, that showed what therapies worked for my child, what therapies did not. The #1 responding therapy has been chelation therapy for years, with between 73 and 75% of the parents saying, my child improved with this therapy. And I find this to be something I do after I fix their terrain. But I have to get them balanced first. There's various forms that we use. TMSA is the easiest for a small child because they don't do well with IVs. But the best thing is calcium disodium EDTA or calcium EDTA. Calcium EDTA we use more for the cardiovascular patient. Calcium EDTA is a true heavy metal remover. without some of the beneficial effects from the cardiovascular system that the disodium ETA would do. DMPS is extremely potent. It is more for mercury removal. It is extremely potent. It needs to be very well monitored for electrolyte depletion because it grabs onto the good stuff as well as the bad stuff. As do most chelators. They grab onto the good stuff as well. So replenishing the manganese, the magnesium, the zinc, copper is all important when you're using some form of these agents to pull metals out. Vitamin C is also a chelator. We do that a lot for immune boosting. But what you always want to do is to prove to yourself and to your patient where you stand by doing a before chelation and an after chelation urine challenge. And that helps monitor response. So you want to have the person do a urine challenge where I'll have them collect their urine overnight for 6 hours, and then come in that morning. I'll give them an IV. I'll have them empty their bladder before the IV, and then collect their urine for 6 hours. So I'm measuring green apples to green apples. I'm seeing what does their body remove on their own, and what does their body remove with a chelator. So I'm actually measuring what is going to come out of them, and you'll see some pre and post studies on patients here in a few minutes. This is a case, just I'll throw a quick case on multiple sclerosis. Friend was a 56-year-old retired nurse with spasticity and brain fog, unable to work, think clearly, had severe fatigue. She was a nurse. She ran around the clinic, the hospital, running the flu vaccine epidemic problems we have, and running them around like a chicken without a head, always doing that, and got so tired, and was falling and really losing her strength. Her hair analysis, and then her urine challenge showed a lot of lead, mercury, cadmium, antimony, and aluminum in her. We started intravenous sodium EDTA, and we added hyperbaric oxygen at 5 times a week for 20 weeks for her. And she returned to work, rained out, decimated wheelchair usage, never thought again. They were thinking about putting her in a wheelchair. She came back to run the clinic the following year. And they're like, what did you do? You were so bad last year. And then she ended up telling her story of what we did in our clinic to try to reverse her by looking at the whole human frame and fixing the terrain and getting rid of the toxins and repairing her inflammation and putting oxygen into the tissues to get the idling neurons to start firing again to get her MS symptoms markedly under control. So when safely administered, it's been beneficial in 73 to 75% of the time. When the parents were asked on this ARI questionnaire, and this is over a 5-year period, and it has always had the best form of therapies in the DAN protocol, and now DAN, as I mentioned before, is replaced by MAPS, the Medical Academy of Pediatric Special Needs. For those of you who came in late, it's a fantastic autism training session for physicians. It's done twice a year in the States. The next one is September 10th in Orlando, and it's a fantastic way of learning about autism. And then 2 weeks later, I'm actually speaking at an autism conference in Dallas with a physician training group for hyperbaric oxygen, which after I tell you a little bit about this, you'll probably be real excited about. But there's a conference in Dallas, Texas on the 25th of September on that topic. If you're going to be in the States for a couple of weeks, please hit both of them. It would be a welcome to see both of you, see any of them. Come on. So when you combine these therapies of hyperbarics and chelation and everything else I mentioned about balancing the gut, then we see some amazing results in the kids on the spectrum. So here is a pre and a post chelation challenge boy on a 5-year-old patient. And this is showing what does the person spill on their own over a 6-hour period on the 1st of October 2010. And the same day, what does he spill with a chelator? And this time, what I do is I do a little bit of DMSA and calcium EDTA when I do my challenges, because DMSA pulls a little extra mercury out. The calcium EDTA is going to bind lead and aluminum and cadmium if it's in the system wholeheartedly. And I wanted to also see what the person's mercury level was. So DMSA pulls lead and cadmium and mercury pretty good. But you're not going to be able to see the results of just calcium EDTA alone when you mix both of them. So it's not pure saying, which I treat them all the time with calcium EDTA when I do the IVs. When I do the challenges, I'll do a little bit of both. But look at this mercury here from 9.2 here, 2.8, lead of 1, and now he's at 63, 62. It's tough to see here. And there's aluminum. He's not able to spill any aluminum on his own. 5-year-old is 130 micrograms per deciliter of aluminum. And then we continued serially with him and found that as time goes on, they were able to reduce down these levels, which was 63 and this was a 9, is now 17 and 3.2. And this is over a period of time that he's coming in every week, 2 weeks, 3 weeks, depending on availability, time, finances, parents getting the child in. Again, this is a 5-year-old, now is a 6-year-old in this situation. So can you give IV chelation to a little kid and then give him a glutathione push? By far you want to do that, because that really ramps up the person's immune system, gets their biochemistry working on their own. This is Cody. Cody couldn't do IVs, so we did oral chelation with him. And this is back when I first was starting here. It should not say DMPS, I'm sorry. This was DMSA. I do not give oral DMPS. But this was a lead level of 22, and this is a lead level of 7.8 in a period of 3 months. That we were able to see reduction of the toxins in his system by doing the various rounds of chelation. Patrick is ADHD, 11-year-old boy with a mercury level of 47 on a DMSA calcium EDTA challenge on the first one. I don't have his free here, but it was negligible. And you can just follow the graphs along as to where he went to as time went on. So we want to see reduction of all the metals. And lo and behold, I don't care about the graph, I care about the child. Is the kid doing better? Absolutely. Is he able to play and do the things we want to do? Absolutely. We did hyperbarics with him. His brother had Lyme disease. He was complaining about his elbow pain all the time. Came out of the chamber, my elbow's killing me. And then his elbow wasn't killing him after a couple of hyperbaric sessions because we knocked the inflammation down. Because he had Lyme in his joint, and he was 2 years older at that time. So he was like 12 years old or 13 years old. His mother came in one day and said, "You'll never guess what my boys did on the beach today." I said, "At the beach. You throw a frisbee around, you play volleyball, you jump in the waves." She says, my kid with the ADHD is reading a book. He's reading the Hardy Boys book on the beach. He was never able to read and comprehend what was on the pages before. And then no matter what we did, it didn't work. At that point, learn wasn't out. This was back in the early start of my life. But I would give this child learn and help expedite his focusing ability if I had the opportunity at that point. This is a great slide. I see you guys have been taking a couple pictures. I'm going to open this one up complete. This is a great slide. I hand this out to my patients. So if you want to take a photo of that, that's pretty easy. How do you reduce your toxic burden? You want to use natural, biodegradable, perfume-free detergents and cleaning agents. Do not dry clean your clothes. On that website I mentioned EWG.org before, there's a section called Skin Deep. Skin Deep will list for you what skin products are healthy on your skin. What makeup do you put on your skin? Do you use eyeshadow? I use Maybelline eyeshadow. Oh, I'm using this as an example. This may be okay, but I didn't look it up. The Maybelline number 7 may have a lot of chemicals in it, and Clairol number 4 may not have it. So you can see what's healthier. Do I put Coppertone on my skin for protection against the sun? Or do I use Burt's Bees? Well, I'm going to use Burt's Bees because it's a lot healthier. Burt's Bees or Kiss My Face are good products. But some of the other products you're putting on your skin is the artist over your body. So why put toxins on your skin when you know that I need to use sunblock? Let me use a better quality sunblock on my child. Let me not use deep, like I said before, on their skin to keep the mosquitoes off of them. Let me use a citronella-based item, because everything we put on our child or on ourselves affects that child. And then I always tell my parents, when you're on an airplane, they tell you, in case oxygen is needed, put your oxygen mask on first before you assist others. If you don't take care of mom, the kid's not going to get better. So you always have to think about what's going on in that family. Why is there a 70 to 80% divorce rate in the United States on parents of autistic children? If you don't take care of mom and dad and have them work together, for those who are doing psychiatry and psychology, you know this. But a lot of us don't realize this all the time. The problems in the family created from having an autistic child is unbelievable. And it's a whole strain on the brothers and the siblings and the families, and they won't get invited to this person's barbecue or party because he has to be gluten-free, and we can't have gluten-free only, and we can't watch the kids. It's a big problem, as you all know. And I really am so happy there's so many physicians here who don't have children on the spectrum. or professionals who are working here with these kids, and it's really humbling to see that. Avoid chlorine if you can. And if you're in a hot tub, kids are going to go to a swimming pool. How are we going to get the chlorine off the kid? So parents will go with Epsom salts, which is fantastic, magnesium sulfate, Epsom salts and water in a spray bottle, and spray the kid as soon as he comes out. Instead of having the chlorine dry on, or wash it off with water, which has chlorine in it, then you use the Epsom salt spray, and that helps remove some of the chlorine off the kids. Common sense stuff. Try to use cotton clothes, avoid flame retardants. Try to use fluoride-free toothpaste. Remember, fluoride is one of those items that blocks iodine, so this is a thyroid disorders. Avoid playing on pressure-treated wood. It has arsenic in it. They have a lot of playgrounds in the States with ladders people climb up, and it's made from arsenic. It's so stupid. It's unbelievable. Try to use an air purifier in the bedroom, get some of the dust. Antimony is in a lot of dust also. People have those light-up shoes that they jump around on. There's batteries in there, have cadmium in it. Why expose kids to all these things? Try to avoid aluminum-based underarm deodorant. Tell the fathers and the mothers not to use aluminum-based underarm deodorant, because the kid is a sponge. He's going to absorb the stuff. So the kid may not be using deodorant, but the father is, and he can't get rid of it because his detox methods are altered. They're playing on the lawn of the next door neighbors, and they're going to come running in the house with their shoes, with the pesticides. Leave the shoes outside. Don't bring the shoes inside the house. Leave the sneakers outside. All common sense stuff that no one thinks about. So this is a great list. I hand this to my patients all the time. Avoid GMOs. My God. GMOs are so bad. I thought I had that. There's also a really good app for your phone. It's called the Non-GMO Shopping Guide. Non-GMO Shopping Guide. So in the States, we have a lot of genetically modified organisms thrown into the food. 94% of the soy, 90% of the corn, 77% of the papaya have the DNA of Roundup or glyphosate impregnated in the food itself, in the seed. Is this good? No. You can buy apples that stay on the shelf for 3 months and not turn brown. Is this good? Apples is a symbol of America. And it's terrible. You can actually get cut up apples now, exposed to oxidation reactions that stay white, because they add an agent that prevents them from oxidizing. Is this healthy? Absolutely not. So when you look at this website, 50% of the wheat, 50% of the alfalfa, canola, melons, can have the DNA of Roundup impregnated within the product. A study came out of MIT recently by Stephanie Sharif, I believe her name is, Senna, S-E-N-E-N-F, which showed correlation as time goes on, incidence of disease on this marker, thyroid cancer, 1990, 93, 94, 95. GMOs got put into the environment at that point. The line follows the increased risk of increased incidence of thyroid cancer, of diabetes, of autism, follows the pathway of herbicide glyphosate being put in the United States to the left. So these are chemicals that are implicated in various diseases, end-stage renal disease, bladder cancer, same graph that goes along, that the incidence of the disease was not there until we added these chemicals to our environment. We have to be careful about the food we eat. Then, it's not you are what you eat, it's you are what you eat eats, that you can't excrete. So if you're eating farm-raised salmon, in the States we feed them genetically modified corn, that means you're eating genetically modified salmon. Or you're having a delicious filet mignon that's cooked Black Angus U.S. grade beef. That's not organically fed. They're being fed on soy or corn, not grass-fed, but grain-fed. And that means we're going to get the DNA of Roundup inside of that. What does that do to our gut? I just put a pesticide in my intestinal tract. Why do we all need probiotics? Not just yogurt. Why do we need probiotics? We need high quantity probiotics to fix our intestinal tract. Where do we store our serotonin? Where is that taken care of? 80% of our serotonin is located in our intestinal tract. The receptors for that. Fortified by gut-forming bacteria. The treatment of choice in the United States, unfortunately, for irritable bowel syndrome is Prozac, or a serotonin reuptake inhibitor. It stops spastic colon, it really does, because it helps maintain our serotonin in our intestinal tract. If we don't take care of the gut, we don't fix the brain. It's considered, the gut is the second brain. The microbiome, our intestinal tract, is really where a lot of research is going to. And if we can fix our gut, we can fix the brain. Read anything from David Perlmutter, who's a great neurologist in the United States. He talks about how the gut is affecting the brain, and it affects the brain. And you'll see that if we don't fix the gut, we're going to be in trouble. So a little talk about hyperbaric as well. So this is a picture depicting the red blood cell over here, and how much oxygen is in the plasma, the liquid portion of the body, before hyperbaric. And then after hyperbaric, we see so much more oxygen bubbles being dissolved within the plasma. If I tested you with an oximeter right now and found out that you have a 98% room air PaO2 in this room, if I gave you nasal oxygen, I'd bring it up to 100%. What would be the concentration in your plasma? How much different? You need pressure to put oxygen into your plasma. The oxygen in your plasma gets into the area where the large red blood cells can't get into. And it helps stimulate nerve function, and it helps stimulate repair. And the brain makes up 2% of the body weight, but uses 20% of the body's oxygen. So small improvements in hyperbaric can markedly improve oxygen delivery to the peripheral tissues and the mitochondria. The mitochondria is where it happens. This is the most important thing to work on. Mitochondrial dysfunction in autism is where a lot of the research is going. Suzanne Go has been doing a lot of work there. Richard Fry has been doing a lot of work in mitochondrial dysfunction and autism.